Honourable Member for Nanaimo-Ladysmith.
Thank you, Mr. Speaker. Last month, I joined my community in Nanaimo on the Walk for Alzheimer's, where our community walked in support of Alzheimer's patients and their families. The honoree this year was the late Dale Horn. She was born in 1933 in Australia. She came to Canada when she was 24. She was such a strong part of Nanaimo's community boards and the life of its community spirit. At this Alzheimer's walk a month ago, her son, John Horn, honored her at the walk for all the hundreds of participants ready to get started, saying Dale was a fantastic companion. She was fully engaged, witty, and keenly observant. She drew you in and made you feel lucky to be in her world. With a steely resolve and genuine grit, he said, Dale was unfazed by her disease. When affected by Alzheimer's, she insisted on helping others with the disease. She retained a wicked sense of humor and immense grace right up to the end of her life. Now, this year's Nanaimo Alzheimer's Walk raised $18,000. This is to promote critical research to reduce the effect of Alzheimer's, but also to provide services for those living with or assisting with Alzheimer's. And this is really to ease the personal circumstances that exist for the people suffering and for their families every day. And it is in that spirit that I'm pleased to stand and speak today in favor of the bill at hand and to speak about Canada's responsibility to improve care for the hundreds of thousands of Canadians suffering from dementia and to give better support to their families and caregivers. Bill C-233, which calls for the development and implementation of a national and comprehensive strategy to improve health care delivered to persons suffering from Alzheimer's and other forms of dementia, is something we can and should all support. But Canada has fallen behind other countries, such as the United States, the UK, Norway, France, the Netherlands, and Australia. All of these countries have coordinated national dementia plans in place already. Past president of the Canadian Medical Association, Dr. Chris Simpson, spoke to this when he said, "We have the dubious distinction of being one of the few G8 countries without a national dementia strategy. Meanwhile, our acute care hospitals are overflowing with patients awaiting long care placement, and our long-term care facilities are understaffed, underspaced, and under-equipped to care for our most vulnerable seniors. This leaves patients and their families in limbo, struggling to fill these gaps in our system." He also said, "The reason your father has to wait 9 months for a hip replacement is that these beds are being used by dementia patients. This is the single biggest reason why elective surgery wait times are so long." End quote. Now, it was the NDP that first introduced a proposal to this House to create a national dementia strategy. In 2012, former New Democrat MP Claude Gravel introduced Bill C-356 in Parliament, prescribing a national dementia strategy. Unfortunately, that bill was defeated at second reading a year ago by a single vote. The bill was opposed by a majority of Conservative MPs, Bloc MPs, and critically, as it turned out, a single Liberal who failed to stand for the vote. I was watching it on CPAC. It was heartbreaking because it would have made a big difference in our communities. Inexplicably, the member for Niagara Falls, the sponsor of this bill before the House today, voted against the National Dementia Strategy just a year ago. If the House had followed New Democrat leadership in the last Parliament, Canadians would have a National Dementia Strategy in place right now. Canadians would not have lost precious time, and that is something that is so precious to people suffering from a degenerative illness. Now, this has had real human impact. I've heard countless stories in my riding about the impacts of Alzheimer's disease and dementia on my constituents. Many cannot afford quality home care for their parents, and it's especially shameful that the Liberals abandoned their election promise to invest $3 billion in home care. I've heard stories from personal care workers, nurses, and physicians who report emergency wards overwhelmed with patients long-term facilities that are understaffed, and long, grueling hours for caregivers. These are often offering low-pay work in the homes of dementia patients. And these stories underscore the need for real leadership in this chamber. So many are effective. 750,000 Canadians were living with dementia in 2011. That's 15% of Canadian seniors. And that might double by 2031. This costs our country $30 billion a year in medical bills and lost productivity. Left unchecked, that number could skyrocket to $300 billion within 25 years. Now, as Canada's population ages, we must prepare our healthcare system and our communities for the inevitable rise in the number of Canadians suffering from dementia. To paraphrase Tommy Douglas, the father of Medicare and a New Democrat, only through the practice of preventative medicine will we keep healthcare costs from becoming excessive. And the need is pressing. The burden for caring for patients with dementia and Alzheimer's falls primarily on family members. In Canada, family caregivers give millions of unpaid hours each year caring for their parents and family. That's $11 billion in lost income. And a 250,000 lost full-time equivalent employees from the workforce. If nothing changes by 2040, it's estimated that family caregivers in Canada will be spending 1.2 billion unpaid hours per year providing care. And a quarter of family caregivers are seniors themselves. Dementia also has a disproportionate impact on women. Women are 2.5 times more likely to be providing care. Women themselves represent 62% of dementia cases and 70% of new Alzheimer's cases. That puts them at the epicenter of a growing healthcare crisis. And women are nearly twice as likely to succumb to dementia. Now, another group of vulnerable patients are affected by another bill in this House, and this is the government's physician-assisted dying bill. We keep hearing arguments again and again that people with a dementia diagnosis should have a real choice over how their lives end. The federal government's legislation for assisted dying will not allow Canadians with a dementia diagnosis, while they are still of sound mind, to make an advance request for physician-assisted dying. And this puts up an enormous barrier for thousands of Canadians with dementia or other degenerative illnesses. Without the right to make advance requests for assisted dying, Canadians with a dementia diagnosis are faced with what the courts called a cruel choice between ending their lives prematurely or potentially suffering immeasurably and unbearably. This is completely unacceptable, and it looks to us as if those who most need physician-assisted dying may inexplicably be excluded from it. We remain optimistic that amendments will be made to ameliorate that very serious flaw. But back to the National Alzheimer's Strategy. New Democrats believe that this bill must be crafted correctly to ensure the best outcome for patients, their families, and their caregivers. While we support Bill C-233, it's less ambitious in its scope and implementation provisions than last year's New Democrat bill. We will work constructively at committee stage to bring about meaningful and substantive amendments to strengthen the final version of the bill. Canadians deserve no less than the best national Alzheimer's matters strategy possible. New Democrats have a long and proud history of advocating for federal leadership on healthcare issues. In fact, as my colleague, the member for Vancouver Kingsway, likes to remind me, we invented it. New Democrats stood alone in this House unanimously for a national dementia strategy in 2015. We stand in this House in 2016 and work so that every Canadian family, every caregiver can have a world-class dementia strategy, as the New Democrats have fought for in the last 5 years. Thank you.